Ang susunod na programa ay rated G. Ito ay pwede sa lahat ng manonood.
This is a special edition of Anobayan channel about coronavirus. From Johns Hopkins Medicine website.org. What is coronavirus? COVID-19. COVID-19 is the disease caused by the new coronavirus that emerged in China in December 2019. COVID-19 symptoms include cough, fever, and shortness of breath. COVID-19 can be severe. In some cases, have been caused death. The new coronavirus can be spread from the person to person. It is diagnosed with a laboratory test. There is no coronavirus vaccine yet. Prevention involves frequent hand washing, coughing into bend of your elbow, and staying home when you are sick. Coronaviruses are type of viruses. There are many different kinds, and some cause disease. A newly identified type has caused a recent outbreak of respiratory illness now called COVID-19 that started in China. Lawrence Sauer, MS, the Director of Operations with Johns Hopkins Office of Critical Event Preparedness and Response and Director for Research with the Johns Hopkins Biocontainment Unit, shares information about COVID-19 and what you need to know. How is COVID-19 spread? Recent information indicates COVID-19 may be passed from person to person. Community spread is being seen. Also, community spread means people have been affected with the virus in a particular area, including some people who are not sure how or where they became infected. COVID-19 had been detected in over 100 other countries, including United States. The spread of this new coronavirus is being monitored by the Center for Disease Control, CDC, the World Health Organization, and the health organizations like Johns Hopkins across the globe. On January 30, the World Health Organization declared the COVID-19 outbreak as a public health emergency and now a global pandemic. How this new coronavirus spread to humans? COVID-19 appeared in Wuhan, a city in China, in December 2019. Although health officials are still tracing the exact source of this new coronavirus, early hypotheses thought it may be linked to a seafood market in Wuhan, China. Some people who visited the market developed a viral pneumonia caused by the new coronavirus. A study came out on January 25, 2020 notes that the individual with the first report case became ill on December 1, 2019 and had no link to the seafood market. Investigations are ongoing as to how this virus originated and spread. What is the incubation period for COVID-19? It appears that the symptoms are showing up in the people within 14 days of exposure to the virus. What are the symptoms of COVID-19? Included cough, fever, and shortness of breath. In rare cases, COVID-19 can lead to severe respiratory problems, kidney failure, or death. If you have fever or any kind of respiratory difficulty such as coughing or shortness of breath, call your doctor or healthcare provider and explain your symptoms over the phone before going to the doctor's office. Urgent care facility to emergency room. Over the phone, be sure to tell them if you have traveled outside the country in the last 14 days, particularly to countries affected by COVID-19, China, Iran, Italy, Japan, and South Korea. Also, be sure to tell them if you suspect you have been close within 6 feet of someone who has COVID-19 for an extended period. Your healthcare provider or the emergency room team will recommend next steps. If you have a medical emergency, call 911 and let them know about your symptoms and recent travel history. For more updates, see the Centers for Disease Control and Prevention or CDC website. How is COVID-19 diagnosed? Diagnosis may be difficult with only a physical exam because mild cases of COVID-19 may appear similar to the flu or bad cold. A laboratory test can confirm the diagnosis. How is COVID-19 treated? As for now, there is not a specific treatment for the virus. People who become sick for COVID-19 should be treated with supportive measures. Those that relieve symptoms. For severe cases, there may be additional options for treatment, including research drugs and therapeutics. Does COVID-19 cause death? As of March 14, 2020, 5,789 deaths have been attributed to COVID-19. However, 72,587 people have recovered from the illness. This information comes from the Coronavirus COVID-19 Global Cases Map developed by the Johns Hopkins Center for System Science and Engineering. Is the coronavirus different from SARS? SARS stands for the Severe Acute Respiratory Syndrome. In 2003, an outbreak of SARS started in China and spread to other countries before ending in 2004. The virus that causes COVID-19 is similar to the one that caused in 2003 SARS outbreak. Both are types of coronaviruses. Much is still unknown, but COVID-19 seems to be spread faster than 2003 SARS and also may cause less severe illness. How do you protect yourself from this coronavirus? The CDC for Center for Disease Control and Prevention has these suggestions. Wash your hands frequently and thoroughly for at least 20 seconds. Use alcohol-based hand sanitizer if soap and water aren't available. Cover cups and sneezes with a tissue, then throw the tissue in the trash. Avoid touching your eyes, nose, or mouth with an unwashed hands. Stay home when you are sick. Clean and disinfect surfaces and objects people frequently touch. What are the precautions for coronavirus? Severe health agencies in China and other countries, including the CDC in the United States and the World Health Organization, are keeping a careful eye on this illness and taking steps to prevent it from spreading. For more updates, visit the Center for Disease Control CDC website. About coronaviruses. Coronaviruses are common different in animals. Rarely an animal coronavirus can infect humans. There are many different kinds of coronaviruses. Some of them can cause colds or other mild respiratory, nose, throat, lung illnesses. Other coronaviruses can cause more serious diseases, including severe acute respiratory syndrome SARS and the Middle East Respiratory Syndrome or MERS. Coronaviruses are named for their appearance. Under the microscope, the viruses look like they are covered with pointed structures that surround them like a corona or crown.